Assalamu alaikum dear students. So we are done alhamdulillah with all the permanent teeth. Today we'll study the deciduous and the differences between the deciduous and permanent teeth. As you all know, up to the age of 12 years the kids have mixed dentition, and up to 2 years they have only milk teeth. So जब तक आपको deciduous teeth, if you do not study the deciduous teeth, you will not able to identify the deciduous and permanent dentition. So you should know the anatomy of the deciduous teeth, as the permanent bud is also lying with the milk teeth. So it is important to know the anatomy about of the deciduous teeth, and you should be able to identify them clinically from the permanent teeth, right? So we'll start. So there are, I have taught you in the beginning, we have three periods of dentition. That is primary teeth that lasts up to 2 years or 2.5 years of age, and the milk teeth, all calcification starts, सारी primary dentition की calcification before birth start हो जाती है. And there are only first molars which erupt. Permanent dentition में सिर्फ first molars हैं जिसकी near to birth calcification start होती है या at birth start होती है, ठीक है. Then we have got the permanent dentition period that lasts from the 6 years. We have got this primary dentition, which lasts up to 2 years or 2.5 years of age. Then we have got this permanent mixed dentition that lasts up to 12 years of age. ठीक है, जब हमारे पास सारे permanent teeth निकल आते हैं तो हमारा ये mixed dentition का टाइम ख़त्म हो जाता है, ठीक है. प्राइम 6 years से लेके 12 years of age तक we have got this. कौन से टीथ है? दैट इज मिक्स्ड डेंटिशन, जिसमें प्राइमरी भी होते हैं और परमानेंट. और प्राइमरी डेंटिशन कब तक है? वी हैव गॉट इट फ्रॉम 6 months to 2 years or 2.5 years of age, ठीक है. एंड after that we have got our primary permanent dentition which lasts, अगर आप लोग ख्याल रखें तो लाइफ टाइम भी हो सकता है, ठीक है. 12 years onwards we have got this permanent dentition, ठीक है. And then we proceed towards the differences. So we will first study the crown differences. What crown differences are present between the primary and the permanent teeth? If you have noticed the smaller kids, they have got the shorter crowns. The size, the morphology of the crowns is shorter as compared to the shorter morphology है as compared to permanent. They are bigger, they have got good contacts with the adjacent teeth. They have got broader occlusal table, because as we proceed, as we grow up, our food habits changes. So पहले हम सॉफ्ट डाइट पे होते, फिर थोड़ा थोड़ा हार्ड डाइट की तरफ जाते, and then our masticatory forces increases, and the primary teeth shed out, and we have got these permanent teeth which have broader occlusal table. They have good chewing morphology than the primary teeth. And then we have this the crown of the primary teeth are constructed in the cervical area. So they have more cervical construction in the crown than the permanent teeth, ठीक है. So you can see here, these are the primary teeth and these are the permanent teeth, ठीक है. And then we have you can see the crowns of the primary and the permanent teeth. Here you can see they have smaller occlusal area as compared to these permanent teeth. They have got broader occlusal area. And they are more well defined. The color, you can see the color difference. They are darker in shade, and they are whiter than the permanent teeth. And there is cervical constriction is more. We cannot observe here because they didn't show the cervical constriction. You will see it when I'll show you the roots. The cervical constriction is more in the cervical area and less in the permanent teeth. Okay? And then there you can see the mesiodistal dimension. The mesiodistal dimension of the primary teeth is more as compared to permanent teeth, where the length is more. Okay? Here the length is short and the mesiodistal dimension is more in the primary teeth. Okay? The length is short. Right? Now what you can see here, there is, we can see the cervical constriction. This is more cervical constricted. Okay? They are more constricted. When more will be obvious in the root diagram, right? And here we can see we have this premolars in the permanent teeth, where the premolar are absent in the primary teeth. Understand? So there is a difference between the premolars. Premolars is present in permanent, which are absent in this primary teeth. The cervical constriction is more. Okay? Now we will go towards the crowns. In the primary teeth have got thinner enamel and the thinner dentine layer as compared to these permanent teeth. So the enamel rods, you have studied these enamel rods in your enamel chapter, that they are directed occlusally in the cervical area, while the enamel rods in the cervical area are directed gingivally in the primary teeth. The color, as I have told you, it is lighter in the primary teeth as compared to the permanent teeth. So we have these differences, and the crowns of the primary teeth are more susceptible to caries as they have got thinner enamel and dentine layer. So they are more prone to caries, and they do not, the kids usually do not take care of their teeth, as the milk teeth are very important. You should be careful about that, because the milk teeth guides the permanent teeth. And these milk teeth, if they are extracted, premature extracted, yeah, they are prematurely lost, then they can cause the different they can cause the disturbance in the alignment of teeth. In the primary teeth, we have got the primate spaces, as the crowns of the permanent teeth are larger and they need the space to occupy the their position in the arch. So you have to take care of primary teeth as they guide the permanent teeth, the underlying permanent teeth, and they will come to occupy these spaces. And if they are lost prematurely, they can cause the disturbance in the alignment of the permanent teeth, right? Now we'll proceed. Here you can see the enamel rods, these enamel rods, which are occlusally oriented enamel rods. ठीक है? ये occlusally oriented होते हैं. ठीक है? और यहाँ पर you can see the permanent which are gingivally oriented. ठीक है? And I'll show you in a more zoomed picture. These are the enamel rod deciduous teeth, which are occlusally oriented. In the permanent teeth, they become horizontal, and then they occupy, these rods occupy the gingivally orientation in the cervical area. Understand? Okay. Now primary teeth are more, these are, the primary teeth are more prominent mesiobuccal cervical ridge is seen, that it is more common in the primary teeth as compared to these permanent teeth. ठीक है, they are less prominent in permanent teeth. The incisors have got no mamelons, and if they have got no mamelons, they will obviously have got no developmental grooves in the incisors. ठीक है, जो incisors है उसमें mamelons नहीं होते, उसमें developmental grooves नहीं होते, जबकि permanent में we have got these mamelons and we have got these developmental grooves present in the incisors. अच्छा, जो हमारे पास प्राइमरी इंसाइजर है, सेंट्रल इंसाइजर, उसकी जो इट हैज़ गॉट जो हाइट है, इट इज़ लेस देन द मीजियोडिस्टल विड्थ. आई हैव told you it before. Mesiodistal width, the central maxillary central incisor are the only teeth in which the mesiodistal dimension is more than the incisor-cervical dimension, while the permanent incisors are longer as compared to the width mesiodistally. This you can see, they have got these mamelons. These are the mamelons. The protuberance I have taught you in the maxillary incisors. The protuberance present in this incisal area, and these developmental grooves are present here. In the maxillary primary incisors, you can see the incisor cervical dimension is less than the mesiodistal dimension. Understand? So this is the difference between the incisor of the primary and permanent. Now we'll come towards the molars. As you know, the primary teeth don't have premolars, they have got molars. So we have got 5 teeth in each quadrant of the primary dentition. So maxillary first molar is a unique molar which has got 3 cusps only. It has got only 3 cusps. कौन से cusps होते हैं इसमें? They have got 2 buccal cusps and 1 lingual cusps. ठीक है, 2 buccal cusps, mesiobuccal cusp होगा, distobuccal cusps होगा, and there would be 1 lingual cusp. ठीक है, and the mandibular first molar has got 4 cusps and a transverse ridge present. In the maxillary first molar, it is roughly trapezoidal in shape. There are 4 cusps present, 2 buccal cusps and 2 lingual cusps, with the grooves dividing them on buccal surface and on lingual surface. The mandibular first molar has got 5 cusps, functional cusps, which I have taught you, and the tip of the lingual cusps are higher than that of the buccal cusps. So now we'll see the pictures. These are the pictures of the primary and permanent teeth. Here we can see the cusps and the grooves of the primary teeth. Here this is the primary first molar having 3 cusps only, right? One cusp is this, and the 2 cusps are on the buccal surface. They are not well defined, right? And here we can see the well defined cusps are present in the permanent teeth. The premolars are present, the first molars and the other teeth are present, right? And you can see the second maxillary molar, that is more or less like first molar of the maxillary teeth. Here on the mandibular arch, we can see this is the first molar having 4 cusps. ठीक है, first molar होता है mandibular, it has got 4 cusps, and the second mandibular molar has got 5 cusps. ठीक है, so you should be able to identify these these E and D and E. This is D and this is E, right? FDI and जो उसमें है palmar system में, ठीक है, and these
इसके साथ ही at the age of 6 years we all can also see the first molar, permanent first molar could be present. So you guys should be able to identify these primary teeth, and you primary teeth with this permanent first molar. ठीक है? So these are the primary teeth, the chief characteristics of the primary teeth, crowns of the crowns of the primary teeth, from which you can identify these are the deciduous and these are the permanent teeth. जो हमारे पास maxillary second molar है, it resembles the maxillary first molar as I have told you. The mandibular second molar resembles the mandibular first molar. The permanent mandibular second molar has got fifth cusp is less evident. Both distal cusps are less developed and the crown is smaller in dimension. The mandibular second molar, the crown is shorter and narrower than the first molar. Okay. The buccal developmental grooves between the mesiobuccal and distobuccal groove is present and the root is distally oriented in the permanent teeth. Here we can see this is what this is you can see the cervical constriction. Here cervical constriction which is more constricted in the primary teeth as compared to the permanent teeth. The roots of the primary teeth are longer. These are the roots of the primary teeth, which are longer, and they root crown ratio is more in the primary teeth and then the permanent teeth. They are more slender and they are flared up. They are flared up because the permanent tooth bud is present between the roots of this primary teeth. You can see यहाँ पर birds present होते हैं. ठीक है, no root trunk is present. There is no well defined root trunk. The root directly start from the cervical area and then extend, right? This is they directly start from the cervical area and then extend. They flare up. ठीक है, and the accessory canals are more common in the primary teeth as compared to the permanent teeth. The roots of the primary molars are more divergent. ठीक है, so it is very important to take the care of these roots while extraction because the tooth bud is lying between these roots. So they can so we don't squeeze the socket after the extraction of the primary teeth because this permanent tooth bud is lying over there. Okay, this was about the roots of the primary teeth. They are जो रूट कैनाल ट्रीटमेंट है उसमें थोड़ा सा प्राइमरी में थोड़ा सा मुश्किल होता है बिकॉज एक एक्सेसरी कैनाल्स कॉमनली प्रेजेंट होती हैं. दूसरी बात ये है कि इट इज़ डिफ़िकल्ट टू treat a child, so it is better to take care of these milk teeth. So बच्चों की ट्रीटमेंट उनको उनकी कॉपरेशन डेंटल ट्रीटमेंट में बहुत ज़्यादा ज़रूरी होती है. सो इट इज़ अ बिट डिफ़िकल्ट फॉर द किड्स to cooperate with the doctors when they say needle and all these things. Okay, fine. Understand all of you? These are the differences: primary teeth, permanent teeth. A pic I have got, you can see larger in size. You can see the root trunk difference between there is a root trunk present. The cervical constriction is more. The color is different. The enamel and the dentine bulk is less than the primary teeth. Okay, fine. Now these are the teeth. You can see the tooth buds present between these roots. These are the primary teeth. These are the permanent teeth, and they will slide. They will during the eruption. They will cause the resorption of these roots. They will cause the resorption of disease and the tooth will then shed out, and these permanent teeth will take the place of these deciduous teeth, right? Understand all of you? You have observed that the kids are more sensitive to pain and these things, pain and pressure, and because the cellularity and the vascularity is higher. The cellularity and the vascularity is higher in these primary teeth than the permanent teeth, and there is the action potential of these pulp chamber, yeah, in the cells of these pulp is higher than the permanent teeth, right? So the primate spaces are present between these teeth. As you can see here, the kid is having these primate spaces. These are the primate spaces which is present because the permanent tooth which has to erupt here, they will occupy the space over here, and the shape and the size of the permanent tooth is larger than these primary teeth. So that if the primate spaces is a normal characteristics which is present in the primary teeth to allow the permanent teeth to erupt in their functional position, right? Here you can see there is in the permanent teeth we don't have these primate spaces, and they are in tight contact with each other, and they are lighter than these primary teeth, and they incisor-cervically are longer, and nasodistally are also longer, wider than these primary teeth. So there are no primate spaces present in the permanent teeth. I hope you all have understood these points, and you will be able to identify now the primary teeth, how to differ the primary teeth from the permanent teeth. We will soon, inshallah, upload you a video of the primary and permanent teeth, how to differ, especially the molars and the incisors, which has got the main differences in the primary teeth, and you will be able to, inshallah, identify the primary and the permanent teeth. Understand? Good luck.